Defibrillators are critical life-saving devices used in the biomedical industry to restore normal heart rhythm in cases of cardiac arrhythmias, such as ventricular fibrillation and ventricular tachycardia. Here's an extensive look at their history, technicalities, and present applications. History of defibrillators. The concept of defibrillation dates back to the late 19th century when physiologists Jean-Louis Prévost and Frédéric Batelli discovered that small electric shocks could reverse ventricular fibrillation in dogs. The first successful defibrillation of a human heart was performed by Dr. Claude Beck in 1947. Since then, the technology has evolved from bulky, AC-powered machines to the portable automated external defibrillators, AEDs, we see today. Technical aspects of defibrillators. Modern defibrillators come in various forms, including automated external defibrillators, AEDs designed for public use. They automatically diagnose life-threatening cardiac arrhythmias and are able to treat them through defibrillation. Manual external defibrillators, used by healthcare professionals, allowing them to determine when and how much electric current to deliver. Implantable cardioverter defibrillators, ICDs, surgically implanted devices that continuously monitor heart rhythm and deliver shocks when necessary. Wearable cardioverter defibrillators, WCDs, external devices worn by patients at risk for sudden cardiac arrest. The technical operation of these devices involves delivering a therapeutic dose of electrical energy to the heart with the aim of depolarizing a critical mass of the heart muscle, allowing normal sinus rhythm to be re-established by the body's natural pacemaker. Present applications of defibrillators. Defibrillators are now widely used in various settings, including medical facilities. Hospitals and clinics are equipped with manual and automated defibrillators for emergency resuscitation. Public spaces. AEDs are commonly found in airports, malls, and sports arenas for use by the general public in case of sudden cardiac arrest. Home and personal use. Patients with a high risk of sudden cardiac arrest may have an ICD implanted or use a WCD for continuous monitoring and immediate treatment if needed. The advancement of defibrillator technology continues to improve patient outcomes and has become an indispensable tool in the fight against sudden cardiac death. With ongoing research and development, future defibrillators will likely be even more effective, with enhanced capabilities for early detection and treatment of life-threatening cardiac events.